Welcome to Umbrella ND's groundbreaking Health Equity Panel Series for neurodivergent adults. We're bringing together diverse voices to tackle the most pressing health equity issues facing neurodivergent communities today. At Umbrella ND, we believe that true wellness goes far beyond doctor visits and prescriptions. It's about creating fair opportunities for everyone to live full, thriving lives. Our panel series explores how a person's wellness is intrinsically connected to the social, economic, and environmental factors of their life. Throughout this series, we're moving beyond one-size-fits-all approaches toward solutions that recognize and celebrate the unique experiences and needs of all neurodivergent people from diverse cultures, genders, spiritualities, religions, generations, and sexual orientations. This vital work is made possible by supporters like you. If you believe in health equity for neurodivergent communities, please consider making a donation to Umbrella ND. Every contribution helps us continue these essential conversations and build the resources our community needs.
Everyone, and welcome to Sausage Links. I am one of your hosts, Jeannie V, and I want to thank you all for joining us as we continue the conversation about the impact of recent legislation on how we advocate for ourselves. This is a continuation. Last week we began talking about the One Big Beautiful Bill that was recently passed, and today we're going to pick up on some of the specifics of that we did not touch on. Before we get into that, allow me to give you a brief description. I am a transgender woman. I have shoulder length, auburn, brown, reddish hair. Today I'm wearing an orange spaghetti strap top and a pride pin on my shirt. I'm not going to, pretend that my voice is feminine in any way, shape, or form. This is who I am. So if you're listening to this and you're wondering, wait a minute, that doesn't sound like what I'm used to, that's because I choose not to. And I have with me today my co-host, AJ Locascio. Hey, AJ.
Hi. Hi, everybody. I am AJ Locascio. I am I always struggle with this, y'all. I always do. I didn't have it written down, so I'm going to fumble as normal. Okay. I am a genderqueer woman with short black, purple, and blue hair. I have large glasses and headphones on. I am wearing a black t-shirt that says, "Read books, be kind, stay weird." And across my shoulder, you can see I have a pouch, and in the pouch is my good timing widget. In the pouch is my Italian Greyhound widget, who is providing much needed heavy weight this morning as we get into this heavy topic.
Exactly. And for those who may not be familiar, the One Big Beautiful Bill recently was an appropriations budgetary movement from the legislature that the president signed into effect. And this bill essentially is going to accomplish three things. It's going to change budgetary requirements for recipients of, federal monies. It is going to shift the wealth of individuals within this country, where we're going to see those at the bottom of the stack having to take more of a burden while those at the top of the stack receive more benefits. The third thing that it's going to do is it's going to impact specific marginalized communities in very deep and powerful ways. And we are already seeing negative impact on those communities. So last time we talked a little bit, we talked in depth really about the shift in wealth. And we talked about the inequity of, finances last time. We also talked a lot about the the impact of Medicaid and the loss that was going to the funding for medical care, the funding for hospitals, how that was going to impact the the entire country. It's not just impacting the poor; it's going to impact almost all of the country when it comes to receiving medical care in one form, fashion, or another. Today, we're going to focus a little bit more on SNAP benefits and what that can mean. AJ, I do want to throw an audible in here, and definitely want to talk also about the work requirements.
Yep, absolutely.
And how that is instrumental in the shift of wealth, but also detrimental to those who need help the most. And finally, if we have time, we're going to get into how this is going to impact, marginalized groups, especially at this time, because one of the biggest pieces of the legislation that came out of this, how it's going to impact the LGBTQ plus community. So without any further preamble, SNAP benefits, if you're not familiar with that, SNAP is a supplemental nutrition program that the federal government funds. In the past, we called it food stamps. And that money is sent to the states, and the states distribute it to individuals so that people will be able to afford supplemental food.
Right.
SNAP benefits are not intended to be the only, food assistance that somebody receives. So SNAP benefits are supplemental. They're only supposed to provide, where there's a shortfall. And we know that those were already not doing the job.
Yep. And, this bill, it doesn't just cut SNAP benefits. It is reducing nutrition funding in general.
Yeah.
So that can impact everybody at a certain level. And why nutrition doesn't seem important, I can't answer that question, but it's reducing the funding, including that to SNAP, and it's reducing it by 186 billion, around that number.
Mm-hmm.
Now, this isn't happening next week.
No.
It's starting in 2025 and being reduced over time, with that final 186 billion being reduced by 2034.
Right. Now, to kind of put this into perspective, 40 million Americans receive SNAP benefits.
Yep.
And that 40 million Americans, 40% of those, especially in the rural areas, are children. But we also know that this is going to impact in large demographics those individuals who are elderly, as well as those people who are disabled and cannot work. They receive those benefits as part of their disability eligibility. And so the rough estimate is that 6 to 9 million, billion with a B, billion meals will be impacted annually. And that is only through one source, and that is through Feeding America. Feeding America is, a part of supplying food banks and helping out with the 200 food banks and 60,000 faith-based and charitable partner organizations that redistribute food to people. 6 to 9 billion meals a year just in that organization. And we're talking about children, we're talking about the elderly, and we're talking about disabled people who are going to take the biggest hit on that. In terms of food assistance, AJ, what do we see SNAP benefits being able to do, and in a broader sense, the entirety of food assistance that the government provides?
Well, when we look at this and we think about families and we recognize that there's over 22 million families who are going to lose some or all of their benefits, of their SNAP benefits. 5.3 million families are going to lose $25 per month. Now, a lot of people go, yeah, $25 per month, whatever. Don't go out and buy a couple coffees. These are families that don't go out and buy a couple coffees.
Exactly.
Right? These are families that $25 a month is crucial to them having nutritional food. And if we're being honest, that $25 a month isn't even enough. There are people in these families, from my personal experience working with low-income families, there are people in the family who choose not to eat so that the child can eat.
Mm-hmm.
Right? These are families who may be working multiple jobs and yet still are not able to provide what they need because food is expensive.
Yeah.
Healthy, nutritional food is very expensive. So on average, they're going to have $146 per month lost in support. So this is, we take their Medicaid losses and then we take the SNAP losses. We're looking at $146 a month that they're not going to have.
Right. And
that's a lot of families in our community.
It is. And again, when we talk about losing SNAP benefits, and when we see that, a over 1/3 of the recipients of SNAP benefits are children.
Mm-hmm.
You've probably seen the impact of low nutrition on kids, especially when it comes to education.
Absolutely.
What does that look like on a day-to-day basis with kids who don't have enough to eat?
Well, first of all, it means that, this is big. This is really big. And here's why it's really big. Because states are now having to, with this shift in this bill, states are going to have to pay 5 to 15% of the benefit costs themselves.
Mm-hmm.
Right? So that's a big thing right there that affects everybody in the state, every single person. Okay. So there we've got that. Schools get support
Mm-hmm.
to provide meals to students.
Right.
Okay. The kids have to get to school early to be able to have that meal.
Mm-hmm.
Oftentimes if they have that meal and they come in on the bus, they're like running in, they have to, hurry up and have that. And then they're going to class. Often these meals are, carbohydrate based, right? They're not like packed with protein or anything. And these kids they come to class hungry. Yeah. They've already had a lot of stress because they've been in a rush.
Mm-hmm.
Or, they had to walk to school early or get a ride to school early, whatever their specific situation is. Right. So they are experiencing stress and they are hungry, and there are commercials on TV about being hangry, right? Mm. And it's always really funny. It's not funny. It's not funny at all. When you have children who are coming to class and they are expected to sit and learn, mm-hmm. and their stomach is grumbling because they're growing and they're starving. Learning isn't happening. And we know that we have a crisis in education in this country. Part of that is because of nutrition.
Yeah.
It really is. And then to cut these benefits and then cut the funding that states are getting. And now states have to pick up. Honestly, some states are going to be forced to cut benefits further,
Right.
or opt out of the program altogether.
Which some states have already started talking about that.
Yes, they have.
And to go even further into this, to show just how little concern there is over this, over the last 4 to 5 years, we've seen state legislatures pass resolutions and legislation and attempt to pass things that would prohibit monies to be given to schools if schools were somehow in violation of the morality laws that were being passed.
Mm-hmm.
Whether that is the support of transgender youth, or that is the don't say gay, prohibitions. It could also be, we've seen that recently they've gone after schools that are important, they are targeting those students who are immigrants.
Mm-hmm.
And we've seen these states already make the move to cut funding from those schools, because their belief is that if a school is not going to play along, the life of the children are not going to matter. That's the equation. Play by the rules, your kids matter. Don't play by the rules, your kids don't matter.
Yeah. Okay, this goes further. This goes even further. The SNAP benefits specifically, also for 600,000 plus folks, especially elderly and disabled, their SNAP benefits include utility allowance.
Mm-hmm.
So that means that you get support in making sure that your electricity is on.
Yeah.
Okay. So when we're looking at these households who have elderly and disabled members, and they're losing this additional support, people die when they don't have electricity.
Yeah, exactly.
Okay. And this isn't because, they need their light on to take a shower or whatever. Yes, that is very helpful. But we have people who have medical equipment
Mm-hmm.
that it has to stay on.
Yeah.
Right? It absolutely has to stay on. And even if they've worked already with the utility company to make sure that their power stays on, and they have things in place for that, accidents happen when bills like this come in, and there are these big shifts and there's chaos, which we've been seeing a lot of chaos. Accidents happen and people die.
Yeah. And in some states, for example, the state that I am in, there is no requirement of the electric providers, to keep electricity going to a home for air conditioning. Now, there is for heating, but not for air conditioning. And the last giant push of a heat wave that swept across this country, I know we saw at least a dozen deaths from heat-related impact. And so this is the reality of this. And this time of year, we're not talking about keeping the heat on in the winter. We're talking about keeping air conditioning on for those people who are going to be impacted by temperature sensitivities.
Mm-hmm.
There are some people that if they, if it is not, if it's not a reasonable temperature, it will impact them in a very negative way.
Oh yeah, I'm one of these people where I have a very, very small threshold for how warm I can get.
Right.
Well, let me be honest. My mom, last week, we were out. We weren't out too long, but we were out in the heat, and it caused her to have a seizure
Mm-hmm.
because the heat was so overwhelming. And that was just from going out on a small grocery shopping trip.
Yeah.
So, I mean, that's one example. I don't have that seizure-like behavior when I get overwhelmed with the heat, but my productivity definitely goes down. I'm not able to think and react and do as well because my senses are completely overwhelmed by that feeling of being sweaty, which really, really impacts me.
Yeah.
And I would say, okay, fine, that impacts me. I can go rest and sit in front of a fan. But my community is impacted when I can't work.
Exactly.
Right? My community is impacted when I can't work as well as I could if I didn't have to deal with that.
Mm-hmm.
And so it matters. Not everybody understands, but it does matter.
Especially when the Medicaid requirements that we are looking for requires able-bodied disabled people to function at 80 hours a month.
Right.
And when they don't have the money to cover food, when they don't have the money to cover utilities, when they don't have the money to cover medications, because we do know that some people choose food and utilities over medication.
Absolutely.
And so these able-bodied disabled people are not able-bodied anymore because of the impacts, the multiple forms of impact on their ability to function.
Yeah. Let's dig into this a little bit. This gets me fired up. Okay. And I need to get fired up this morning. I'm struggling today to be able to think and do all of the things. Excuse me. The work requirement age is going from 54 to 64.
Mm-hmm.
Okay. Currently, it applies between ages 18 and 54.
Right.
So that work requirement age is now bumping up to 64. Parents of children aged 14 or older have to meet those work requirements. Okay. So, your child is 14
Mm-hmm.
and now you have to work 80 hours a week.
Month.
Or sorry, 80 hours a month. 80 hours a month. Let me correct myself there.
Right.
At work or volunteer.
Yes.
Okay, work or volunteer at least 80 hours a month. And that's like, okay, we get it. Your child is older, they can take care of themselves. Not all 14-year-olds are able to do that.
No.
Okay, so that is being exclusive like that without taking other things into consideration is not okay. Veterans,
Mm-hmm.
unhoused people,
Mm-hmm.
and former foster youth
Mm-hmm.
also must meet these work requirements.
Yeah. So
it's not easy to get a job when you're unhoused.
Exactly, because in many cases you have to have a physical address to use in order to get a job.
Yep.
And as my
As
partner,
well as the appropriate clothing and the,
right,
appropriate hygiene and all of these other expectations.
right, my
Like
partner,
having a computer to be able to apply for jobs.
exactly, my partner hires people on an ongoing basis, and because of the unhoused situation that we have in this country, she gets a lot of unhoused people who want to apply for a job. But if they don't have an address, if they don't have, a tangible place, that requirement is an automatic no hire.
Yeah.
If they don't have a place to live, it's a no hire.
Right.
So when we look at the overlap of, just like you were saying, veterans and mentally ill, mentally, suffering individuals, and youth, especially marginalized,
Mm-hmm.
that zero overlap right there, that big overlap is homeless. Those things do have something, those groups do have something in common, and that is a significant portion of them are homeless.
Yes.
And without homes, there's no place to, there's no way to get a job. There's no way to necessarily qualify for those benefits,
Mm-hmm.
which means that the only way to receive those benefits is actually to go to some middleman organization, some government assisted or nonprofit based distributor of that. And that gets us back to the discussion of Feeding America.
Yep, exactly.
And food banks. There are already there's a significant decline in contributions to food banks. There's already longer lines to get something from food banks, even though those, what they give has to be portioned down. We're watching these organizations, get to a place of not being able to meet the demand. It's not a need, it's a demand. In May, 15.6% of adults were food insecure. In May of this year, 15.6% of adults were food insecure. And that means they did not have the necessities in their diet, in their household, for nutritional, healthy eating. And food banks, which have already been stressed, these supplemental programs, which have already been stressed, are being pushed to a snapping point.
Mm-hmm.
They're being pushed to a point where they can't do the thing. So as we watch supply of supplemental assistance, as we watch, the dwindling of contributions to, external programs, all of that is, all of this is going to contribute to impact all of these groups that we've been highlighting. All of these groups are going to be impacted in such a way that the able body requirement is now impossible.
Yep.
And keep in mind, if you can't get a paying job to meet that 20 hours a week requirement, that means that you have to do unpaid labor.
Yes.
So instead of working 20 hours to get a paycheck, which can help you survive, you have to do 20 hours of unpaid labor in order to meet this arbitrary requirement.
Right.
So this isn't, this is not meant to, criticize a government group.
Right.
This is laying out the facts. This is laying out why we are now in a dangerous situation.
Yeah.
Because we are going to see individuals between 18 and 65 who already cannot work for one reason or another, or we are going to watch people who are under the age of 18 who are not supposed to work in order to survive, having to fight for survival.
Yes. And we see that all the time in our high schools.
Right.
We see kids in our high schools dropping out or just being exhausted because they go to school all day. They are working really, really hard in, let's say, an AP program because they know that that's going to help them get a scholarship, which is the only way they're going to be able to go to college. And they are working after school. They're working as many hours a week as they're able to work.
Mm-hmm.
And in order to help their families. That again, this contributes to the crisis of education that we have here in the US.
Right.
Okay, so the thrifty food plan. Okay, SNAP influences directly the thrifty food plan directly impacts how much the SNAP benefit is for a household.
Mm-hmm.
Okay. This bill has also limited future increases. It is restricting future updates to the thrifty food plan.
Right.
Ultimately, what this means is a person's SNAP benefits may increase, but over time, those increases are going to be less and less.
Yeah. Now, very quickly, the thrifty food plan is one of 4 plans that the USDA develops that would estimate the cost of a healthy diet,
mm-hmm.
stress healthy, across 4 different price points. There are the liberal, the moderate cost, the low cost, and the thrifty. So the thrifty is the lowest cost estimation. This is supposed to represent a nutritious, practical, cost-effective diet prepared at home for a reference family, which is typically an adult male, an adult female, and 2 children between the ages of 6 and 11. So that's what we're talking about when we talk about, this is where the numbers come in, right? To determine, what is the funding that we need to be able to do. The thrifty food plan is supposed to align with dietary guidance. And we also know that the current administration is changing dietary guidance. It represents a limited food budget, but it does not reflect the desperate swings that we have been seeing in food prices.
Mm-hmm.
It reflects what Americans buy and eat, and it is supposed to support a healthy, active lifestyle.
Yeah. So if you look at a chart, so this is from 2021 was the last time that this was revised.
Mm-hmm.
For a family of 4, you have $47 for protein a week.
Mm-hmm.
Okay, $193 a week for food. On this chart, it has eggs at $3.
Right.
It has poultry at $17, and it has other meat at $9. I don't know about you. If you have gone to the store, I've really been wanting to cook a roast.
Yeah.
And I'm like, $20 for that little thing?
Right.
No. Families cannot afford that.
Yeah.
You know? Now,
here's the flip side of this, okay? Right? 88. Now, this is according to the same source, the USDA. 88% of SNAP participants reported facing challenges to a healthy diet, and 61% reported that it was the cost of healthy food that was the barrier.
Yeah. It's cheaper to buy a box of macaroni and cheese than it is to buy an apple. It is cheaper to buy a bottle of soda than it is a bottle of water. And I'm saying this because if you live in a home that is maybe not as safe as it could be, that is an older home that has lead pipes, so you need to buy water to drink.
Yep.
Okay, here's another reason why people struggle to buy healthy food. Food deserts.
Yep.
And there are not adequate food suppliers, healthy food suppliers, in many low-income neighborhoods. And for people who have to walk, you know, public transit isn't just something that just goes everywhere and makes life easy.
Right.
Right? Here in Wichita, it takes hours if you're going to take a bus to go to a store. Now, let's say you're disabled. Maybe you are able to use a service provided by the community. The amount of time, effort, and energy that it costs to arrange that vehicle is high. And you have to take that into account when you're expecting people to work 80 hours a month.
Yep.
All of that has not been taken into account to make these rules.
Right.
And that's the issue.
Very quickly, for a food desert to be defined, what it means is that a substantial number or share of the residents live more than 1 mile from a supermarket or a grocery store. Meaning that the idea of living somewhere within 1 mile, and this is in an urban area, 1 mile from a grocery store in an urban area, or 10 miles in a rural area. And so, you know, if it's further than 10 miles to a large grocery store or a supermarket, you are living in a food desert. Because that 1 mile in an urban setting or the 10 miles in a rural setting represents an undue burden to try and go and get the resources that you need.
And I'm thinking about we have a lot of international college students here. They don't have vehicles. They've maybe come in on scholarship or something. They don't necessarily have a lot of money. They live in the dorm because that's required with their scholarship, right? The closest place that they can go to get walk to get groceries is Dollar General, whatever the name is, Dollar General.
Yeah.
The cost of food at Dollar General, I've been looking at this. The cost to buy food at Dollar General is generally equal to and often higher than going to Walmart.
Yeah.
And the quality of food, it's not like you can get fruits and vegetables at General Dollar.
Exactly.
Okay. So you're not getting healthy foods. There's a lot of frozen foods and there's a lot of foods in cans
Hmm.
and boxes.
I
This
actually
isn't healthy.
I did something about this at one point just to kind of make myself aware as well as raise awareness. I did a cooking stream
Mm-hmm.
where I asked people in the chat of my live. I said, you get to pick the ingredients that I have to use. Okay? And so they would pick the ingredients. I would go not to Dollar General. I went to Dollar Tree, where, if there was anything that could be defined as the most economical food source, you would think it would be a dollar store where everything was
Mm-hmm.
a dollar. And at that point, it was $1.25. And I would have to buy ingredients or equivalents and then make a 3-dish meal for myself.
Mm-hmm.
I set myself a budget that was between $15 and $20 for a meal. It can be done, but I was cooking for one person.
Yeah. That's what I was going to say. Compare that to the $193 for a family of 4.
Exactly.
And that's for a family of 4 for all 3 meals
Yep.
every day of the week.
Yeah. And this is, where, this is where the other side of this comes in. Everything that I bought was frozen, pre-made, high in preservative, high in sodium, or it was canned, which you can get some decent canned stuff, but there were no fresh fruits, there were no fresh vegetables, there was no bread, fresh bread. You had to supplement the best way you could on those things that were short.
Yep.
And now we only have a little bit of time left here, Angela. This is going to be more impactful when we start talking about where food deserts are located. Because
Absolutely.
the groups of people that are impacted the greatest are going to be rural Americans. They are going to be predominantly Black areas within urban areas. And they are going to be in those areas of land that are still controlled by the federal government for indigenous peoples. We call them reservations.
Mm-hmm.
These are the 3 most well-known food desert areas.
Right.
And so we're already looking at rural, who are at the lowest end of the poverty, at the lowest end of the income levels.
Yep.
They are in the most economically depressed regions of the country. Many of them are already unemployed because there's not enough work in that area. And then we look at those areas within urban settings that are predominantly populated with Black people. And what we have seen, I know this one personally, is that grocery stores leave because they don't like the environment. They just shutter up because they don't like the environment. They still make the money they're supposed to make, but they don't like the environment.
Right.
And we have never seen the federal government do what they were supposed to provide a healthy life for those people who were sequestered into reservation lands.
Right.
So we know that these groups are already going to be impacted the greatest.
Right. On top of rural communities losing their hospitals,
Mm-hmm.
losing their medical benefits.
Mm-hmm.
These are already folks who it's just a lose-lose.
Yeah.
You look at it over and over and over again, and you can see that the top 0.1%
Mm-hmm.
is going to gain 290,000 a year.
Mm-hmm.
The top 20% are going to gain 13,000. Middle class folks are going to be gaining about 14,000, and these are people who make 53 to 96,000 a year. They're going to have gains.
Yeah.
However, there are folks who live in rural areas who are making that money, and they're going to ultimately lose when the hospitals close. And disabled middle class folks are going to lose their home and community-based service benefits. So they're not gaining. And then
and let's go one more layer to that, especially in rural areas. Typically, your largest employer is a school system, and those funds are being cut as well.
Right. And they're going to lose their hospitals. So all of that, the people who work in the hospital, I mean, it's just, we can see, it is clear, it is a fact.
Mm-hmm.
And again, we will share our resources, just like we did last time. The bottom 10% are losing the most.
Yeah.
It just it makes me incredibly sad, because lives are threatened. You know, between the new work requirements, the frequent eligibility checks, higher copays, retroactive coverage. This is all from the Medicaid stuff. The loss of those home and community-based services for people. We're going to, and I know we're going to get into this next time, but we are going to start seeing increased mental health challenges.
Yes.
Right? We're going to see more depression, more anxiety. We already do.
Yeah.
We already do. More depression, more anxiety, and we're going to see increased rates of dying by suicide.
Yes, we are.
And that greatly impacts many of our marginalized community members, especially when we are looking at neurodivergent LGBTQ plus folks.
Yeah.
And let's just say we refuse to do what has been done and leave the T off of that. Right? Because when they announced the whole 988 line changes, they said LGB, and they purposefully left the T off. They made a conscious effort to make that change, to focus directly on erasing trans folks.
Yeah. And that is definitely where we need to end this episode and pick up next week, because once we get started on talking about that impact, it's going to get much more in depth and much more personal. So
we have a link to the document that we have used, that we created to talk about these talking points. That link is in the description of these. And I'll put it in comments as well. There are some advocacy strategies in there, and there are talking points in there to support you in having these conversations in your own communities. Also, talk to us. We would love to hear what you have to say.
Yep, absolutely. Thank you, everybody, for tuning in. This has been Sausage Links. This is part 2 of an ongoing conversation about the impact of the One Big Beautiful Bill and how that is going to be impacting groups down the line. And we're going to see more and more and more impact as we continue to move forward with this. So you'll want to join us for the next one. Next time we're going to be talking about, in particular, how this is going to be an impact on the mental health of everyone, but also the targeted impact on the LGBTQ plus and neurodivergent community. So thank you all for joining us. If you want more information, you go to info@umbrellaopensdoors.org. And you can find out more about this program as well as all the other work that we do at Umbrella. So thank you, AJ. Thank you, everyone who listened. And we'll talk to you next time.
Thank you for joining us for this important conversation. The insights shared today are just the beginning of the work we need to do together. Ready to be part of the change? Join our community of advocates, professionals, and allies working to create a world where every neurodivergent person can thrive. Visit our website to learn about upcoming panels, access resources, and connect with our community. Your support makes this work possible. When you donate to Umbrella ND, you're investing in health equity, supporting vital research, and helping us amplify neurodivergent voices. No contribution is too small. Every dollar helps us build a more inclusive future. Together, we're building health equity one conversation at a time. Until next time, keep advocating, keep learning, and keep thriving. Visit umbrellaopensdoors.org to donate and stay connected. Thank you.